welcome to the webinar called Menopause and Mental Health, You Are Not Alone, which has been arranged for members of the South Yorkshire Women Inspired Network, linked to Mental Health Awareness Week, which took place from the 11th to 17th of May. My name is Caroline Brannigan and I'm Head of Health and Wellbeing on the Network Committee. Liz Leggett, Deputy Head of Health and Wellbeing, is also supporting the session today, along with Sarah Cook, who's Head of Admin. So just want to start with a quick bit of background about the network if you're not familiar. So the South Yorkshire Women Inspired Network exists to inspire, empower and elevate women from all backgrounds to reach their full potential. Our network offers a dedicated space where women can connect, lead and thrive, supported by mentorship, shared learning and leadership development tailored to their lived experiences. We offer regular webinars, inspirational talks and events, as well as career mentoring and other offers. We'll put a link in the chat for our link tree, which contains our main links, including our website, a form to join the network if you're not a member already, and our social media pages where we post regularly. So we encourage you to follow us on there, and that's where you can follow along with our health and wellbeing campaigns. The session is being recorded, and both the recording and the slides will be added to the Women's Network website, and the link will be in that link tree that we'll put in the chat. If I can ask you all to remain on mute during the session, if you do have any questions, please pop them in the chat throughout, and there should be time for some questions at the end, or we may pick some up throughout the session if appropriate. So I'd now like to introduce Janet. Thank you.
Thank you. Thanks, Caroline, Liz, and Sarah, and all at South Yorkshire Women Inspired Network for giving me the opportunity to speak today about menopause and mental health. And thank you all for giving up your 1 hour as well to come and listen to me. And I hope you find this talk helpful, that it answers some of your questions about menopause and mental health. And I think whether you are personally going through the menopause or not, whether you are female or male, I believe understanding menopausal symptoms, especially the impact on mental health, is important for all of us, because there will always be somebody in our lives affected by menopause, whether it be a family member, if it's not yourself, a friend, colleague, employee. So that's why I think such talks are important for everyone to engage with. So next slide, please. As Caroline mentioned, we are here today because it was Mental Health Awareness Week last week, and that's why the choice of topic. And the theme was take action for yourself, for someone else, or for all of us. So by being here today, really, you are already taking action, whether it is to help support yourself, support somebody else, or simply improve your understanding of menopause. So the association between menopause and the brain is something we have become much more aware of in the last decade, because historically, menopause was seen as the end of a woman's reproductive stage in life. So, yeah, sorry. So, yeah, I was talking about the association between reaching the menopause and its effects on the brain, really, that we've realized more recently that it can affect, your brain, therefore your emotions, your memories, sleep, and overall mental well-being. So, and this is something that I've become increasingly interested in and have spent a lot of time reading up about it. Next slide, please. So I know I've been introduced, but I've been a doctor in Sheffield. I've been a doctor for 33 years. I've been a GP for 26 years, both in the NHS and privately. I'm also a member of the Royal College of Obs and Gynae, which I trained with initially, got my qualifications, then decided to be a GP for more family life balance. I also work at Hallam University as an expert by experience in health and social care. I'm a menopause advocate for the Integrated Care Board, the ICB. I trained in Cognitive Behavioural Therapy with the British Menopause Society to provide CBT for women undergoing menopause, which we will talk about. And because of my passion for menopause and women's health, I set up a new business called Surya Wellbeing Business, and that's a QR code. You're very welcome to look at it if you wanted to. And partly because I think we're lacking some areas in the NHS, but I'm hoping that one day we would have more options opened for women. I'm also a mum, wife, and carer for my daughter who's got a disability, and a volunteer for 2 cancer charities. Next slide, please. So I just wanted to point out resources that you could also access and what I've used for today. So NICE guidance are always updated. That's accessible to anybody. about the menopause. The British Menopause Society website has got lots of information there, not just for clinicians, but for patients or anybody. The Royal College of Obs and Gynae as well. So if you've got any queries about anything that you're unsure of, these are the reliable resources. And then I do, when I've got patients, I do signpost them to books and websites and podcasts. The book that I want to highlight there is Davina McCall's book, which is easy to read. And there's a input from a well-known menopause specialist, Dr. Naomi Potter. And also websites like Menopause Matters. They've all got forums that you can join, Facebook pages, Rock My Menopause, Women's Health Concern, and there's lots of podcasts. And I think that's important because the menopause journey is very different for each person. I think it's unscripted, and that's why it's important to connect and learn from each other as well. Next slide, please. So this is a list of what women come in telling me, really. Not everyone comes in saying, I've reached the menopause, or I'm perimenopausal, which I'll describe the difference later. I want HRT. No, some people come in not knowing if it is the menopause. They want reassurance, or people are genuinely scared that they are losing their memory, or, and how it's going to affect their lives. So these are some of the things. I'm going crazy. I have a menopause brain. I'm irritable, feeling low for no reason. They might come in saying, I've got a happy home, I've got a good job, but I'm teary and I don't know why. I was a high achiever. I've reached the top of my career, but I'm struggling now to cope with it. I'm scared. I'm changing physically, emotionally. I'm becoming a different person. I'm shouting at my partner. I don't want to have sex. I feel sorry for my husband. I'm not the same person. I can't find things. I'm losing my memory. I go blank at meetings. I have mood swings, and I can't sleep due to hot flushes or restless legs. And these, sorry, I can hear someone talking.
The only thing that you can take that ladies have been ticking is not known.
Can you all hear me all right?
Hey, fine, Janet. I'll just see if I can find who's talking and try and put them on mute. See. Please continue.
Sorry, Janet, you're muted.
Where did I move? Should I just start a bit? Yeah, so a lot of times this can coincide with life events. So, you could have teenagers going through hormonal changes and children leaving home, going to university or going to live independently. So the empty nest. And also we're at a stage where we could be looking after ill parents, or we've worked so hard, got to the end, to the top of our ladder, and then bang, we're hit by all these menopausal symptoms that we have to now cope with. Next slide, please. So actually, before I go on to the slide as well, I just want to say that I've experienced this myself because when I was caring for my daughter who was ill for many years, I was having symptoms and menopause didn't even cross my mind because I just felt these symptoms were related to the stress that we were going through. And then later when things didn't subside, then I realized I needed to go and see my own doctor and get help with it. So like I said, menopause is defined as when the ovaries stop working, periods end, estrogen levels plunge. I do use the word plunge because it does. And so menopause officially is diagnosed when a woman of 50, over the age of 50, has not had a period for 12 months. Or if they're under 50, then for 24 months of no period. So during this time, because the hormone levels are fluctuating, someone can still conceive and contraception may still be needed. So the average age of menopause in the UK is 51, but that can vary between individuals and ethnicities. And menopause, it's normal to start from the age of 45 onwards. Early menopause is when a woman is between the age of 40 and 45. Premature menopause is under the age of 40. And that occurs in 1% of women. And this could be due to if they've had surgery to remove the ovaries, if they've had cancer treatment or any chronic medical conditions that have affected their ovarian function. Now, perimenopause, I think, has been we are more aware of it in the last decade. It can start 4 to 8 years before the menopause. And it can be easily missed because, and I'm sure I've done it as well as a GP in the past, not recognizing it because women still have their periods, but they might come in with stress and anxiety and they may not have had any mental health problems before. And we quickly have, and we've forgotten that actually we've not realized that they were going through the perimenopause. So I'm definitely, as a GP, more aware of it now. Next slide, please. So this graph is really to show what happens in the perimenopause, especially. So you can see these are the estrogen levels, and they're erratic. They're going up and down, and everybody's graph is going to look different to this. So our brain is getting mixed messages of, because we've got estrogen receptors in our brain. So estrogen is the hormone, the female hormone in our body, and that's what drops in menopause. So it's fluctuating, and that's what causes a lot of these severe symptoms that we have. But the good thing is, when you reach your menopause stage, the fluctuations do reduce, and eventually it becomes a straight line. So in my head, everything gets calmer. So there is hope. But what do we do at this stage? How do we help women cope with this stage? So next slide, please. So the symptoms of menopause. There's loads, and these are just some of the few. And also some women don't experience it. And some women have mild symptoms and able to cope, not needing any help. But 44% have 3 or more severe symptoms. So we do need to be aware of these symptoms and what sort of help to get. So trouble sleeping is a big thing. Brain fog. Brain fog was a term which I first heard actually during COVID time, and I hear it more now with the menopause as well. Anxiety, depression, hot flushes, night sweats. And these hot flushes, night sweats is what I call vasomotor symptoms. And they affect 70% of women. And I think so to me, that is quite significant when we look at mental health, which I'll go through later. Vaginal dryness, recurrent urine infection, muscle aches, a reduced libido, fatigue, dry skin, hair loss, palpitations. And so many of these symptoms, you can see how they can directly affect mental health just on its own. Next slide, please. And this is just a bit more of, I won't read it all out, but sort of other psychological, emotional symptoms that somebody can be affected with. So panic attacks is there as well. So hot flushes is what we want to concentrate on at the moment. And I think it's important to understand why you get a hot flush to be able to cope with it. Because we fear the unknown, don't we, normally? So understanding this can maybe help us cope better. So the way to think about it is that your brain is a thermostat. So the top graph is when you're not perimenopausal or menopausal, and your brain thermostat is set at a certain stage, which is the 2 lines. So that's the range. So there's a range where your body can cope with temperature changes. However, thinking back about that graph earlier, during the perimenopause and in the early stages of menopause, when your levels are going up and down, it confuses your brain. And therefore, it doesn't know what to do in terms of your body regulation. So it narrows the range of temperature that your body can cope with. Therefore, any slight changes in temperature out of that, you can get, or I can get, extreme symptoms like hot flushes or even shivering. Next slide, please. So why is mental health affected? As I mentioned, hot flushes encountered by 70% of women, and this can start before you stop your periods during the perimenopause stage. So when you've got a hot flush, night sweat at night, let's say, your sleep is affected. And when sleep is recurrently disrupted, your concentration suffers, your memory is affected. You wake up in the morning, you don't feel refreshed. It affects your confidence. It can affect your self-esteem. When you get a hot flush during the day, you could feel embarrassed. You get you feel like there's a lack of control. Women start doubting themselves. Therefore, it affects functioning at work. You try to not be as active socially. It affects relationships. It affects sex life, and therefore it can affect mental health. But often it doesn't end there. The next slide. You find yourself like a hamster on a wheel, really. It's a constant battle. Because when you're low, your other hormones are triggered, and your hot flushes and all your other menopausal symptoms can be exaggerated. So your adrenaline levels go up, your cortisol levels go up, you can get palpitations, you get sweaty, your breathing is altered, like panic attacks, shallow breathing, you look flushed, and there you find yourself again in that cycle of losing confidence, embarrassed, avoiding situations. You might lack motivation to exercise, because women might not exercise because they are embarrassed that they're going to be having hot flushes during while they're exercising, especially amongst a group of people. And then we can find ourselves comfort eating as well. So these all, in a way, interact with each other and can make your symptoms that you're already feeling worse. And just to say, cortisol levels, when they rise, it's the hormone that contributes to fat distribution in the abdomen area. And then sleep is affected again because you're anxious. And like I said, you're constantly battling this, and it feels like a never-ending story. Next slide, please. And before I go on to what else we can do, just to say that somebody with a past history of depression, postnatal depression, premenstrual mood changes can be at slightly higher risk of developing mental health changes in the menopause as well. And 10% of women are more likely to have depressed mood during the menopause. So we've talked about the hot flushes, and that affects sleep, affecting our mental health. But there can be other social causes as well, like cultural beliefs, really. I think quite often people say or feel like, our mums, aunties, uncles went through with it, and therefore we feel like we can't maybe express how we're feeling, or we think we shouldn't be feeling as we are. Historical attitudes about seeing this as a stage of end of reproductive life, therefore women can feel a loss of identity. Ageism portrayed in the media can also sort of alter our way of seeing the menopause, plus the life events that I mentioned. And then lack of sleep, yes, could be due to hot flushes, but also if you're waking up regularly to go to the toilet in the night, if you've got body aches, and also sleep apnea that affects sleep, that can also further contribute to mental health. And sleep apnea is recognized to be something that's seen in the menopausal stage. So even if you're not been a snorer all your life and you find yourself snoring later on, it's because as the estrogen levels drop, your airways lose their muscle tone, and therefore they can easily collapse. So if you find that you are snoring, or you're tired, because some women do present with tiredness, not snoring, and therefore it's important to just be aware of that, really. Could it be sleep apnea as well? Plus the body changes that we encounter, I think, can also sometimes affect our mental health. And just to highlight that perimenopause and menopause is a stage in life, really, just like how, we reached our periods and we started puberty. It's not an illness. However, it still needs to be managed for good quality of life if anyone is needing the help. Next slide, please. So what can we do? General lifestyle changes first. Exercising releases endorphins, which are the happy hormones that in itself can elevate mental health. I was just going to say that South Yorkshire Women's Inspired Network do a lot of talks, lunchtime talks around physical health as well, and weight management and mindfulness. So you might want to tap into these. Then there's the free app, which is Couch to 5K. And it's a good app to help you getting active again because it starts with walking initially. But I also think a variety of exercises help, like weight-bearing exercises, because we tend to lose our muscle tone when we reach the menopause, muscle mass, sorry. So it's important to, so you've got other sort of benefits of exercising, not just with mental health, weight management, reducing aches and pains. And if you are concerned about how, your body changes, your weight, the way your body looks different, a Mediterranean diet is something that is recommended. It's got the healthy fats, it's got less processed food, it's got less sugary food and more sort of fresh products. It's got omega-3. And if you feel that you've done everything and you still are not losing weight, then it might be worth calorie counting. There are free apps around where you can access, just add in what you would eat normally, and then see if you can take 500 calories off persistently. And that can gradually make you lose weight as well. So little things and choosing what suits you best is the way to go. Alcohol, reducing alcohol, caffeine, spicy food can reduce hot flushes. And if you've got body aches and pains, then, is your vitamin D low? Is your calcium intake good enough? And there are some suggestions I've put on the slide for that. And then nothing like mood support in terms of talking to friends, going for a walk, and taking time out for yourself as well. Next slide, please. So NICE recommends hormone replacement therapy as the treatment as the best or most effective treatment, supported by the British Menopause Society for menopausal symptoms. I'll tell you a bit about HRT. I know it's not for everyone. I think in the past, when I think back, because I see it as 3 different stages of my life as a GP, we used to just prescribe it. We reach the menopause, have it. And then we had the Women's Health Initiative that came out saying that breast cancer risk was higher with the HRT, especially estrogen and progesterone together. But in the last few years, I think research has changed, science has changed, attitudes have changed, and the risk isn't as high as we think it was. In fact, drinking regular alcohol puts you at a higher risk of developing breast cancer than HRT. So what's changed? The type of estrogen and progesterone that we use now in HRT preparations is more what we say bioidentical, so very similar to the hormones that are in our own body. So they're not so modified or synthetic type. And also the way we give it, transdermal meaning through your skin, whether it be a gel, patch, or a spray as well. If you've got a uterus, you need progesterone as well, because when you think about it, when we had our periods, estrogen builds up the lining of the womb. And then if there isn't a pregnancy, at the end of that month, that layer is shed. And that's because the progesterone levels go up and that layer is shed. And that's important because if we just have estrogen, that layer is built up and puts somebody more at risk of endometrial cancer. So if you don't have a uterus, it's fine to just have estrogen. If you do, progesterone you can take it as a tablet or as a coil, the Mirena coil. There are other coils, but you need to check that it's licensed for HRT use. And that coil can also be used as a contraception. So if you're in that time of the month in time of your stage where you might need contraception as well, especially the perimenopausal stage, the Mirena coil is a good option. So testosterone is the other hormone we talk about. So if energy levels don't improve, libido doesn't improve, you're still feeling very low, then what NICE guidance say is that if you are if your HRT is at the level that you should be on, and nothing else can be done, including anything else that you have tried, then you could get a testosterone blood test and treatment, but this isn't readily available in the NHS, I would say. So, you might need a specialist input for that. So HRT, I think it's a choice. Women need to be well informed, and that's why I always signpost women to the resources before starting it, because it needs to suit your lifestyle. And also there needs to be no contraindications, of course, because some people have got medical contraindications and can't have HRT. Next slide, please. So this shows you, so the bubbles are what we talked about, the mood changes, the stress, hot flushes, bodily changes. And like I mentioned, it goes round in a circles and one can make the other better. So cognitive behavioral therapy is used to break this cycle. So it's the only complementary treatment recognized by NICE for women to help women with hot flushes, night sweats, sleep, which then can improve lots of other things that we talk about, like mental health as well. So how does it do it? It's changing your mindset, and it's looking at slight behavioral changes that you can do. It's done in a very slow way over weeks. It's not something that can be done in 10 minutes in a GP surgery. It's something that's done in sort of 4 to 6 weeks. And it's tailored to your needs, really. It's going through how menopause is affecting you, what your symptoms are, what else is going on in your life, and how you can alter and make it all work and break this cycle. So that's what cognitive behavioral therapy is for menopause, and you need you get it from somebody who's trained in this with menopause. So yeah, I believe that understanding what's happening in your body, as I mentioned earlier, can help reduce the fear and improve confidence in managing your symptoms. Other things, stress, for example. So we've talked about HRT, we've talked about CBT, and now I'm looking at other sort of ways that can improve, other things, symptoms in menopause, like stress. So prioritizing your own health. I think as women, we've spent years caring for people and working, putting our energy into work. And I think it reaches a stage in our life where we need to step back and think, you know what, I need to think about myself and my health as well. And that's important, not just for us, but for the people that we care for too. We could feel guilty, but I think we shouldn't. Because, like I said, because it's important. We want to keep going with life. Retirement age has gone up, so we want to be well enough as well to keep working. So prioritizing your own health, well-being, remembering not to rush. And I think sometimes consciously we need to remind ourselves to pace ourselves and not rush. Like when driving around, I see people sort of speeding here and there, and I think, you know what, at the end of the day, it's just going to put your stress levels up and the other person's stress levels up. Where does it get us anywhere further forward? Probably not in majority of the cases. Keeping a balance between rest and activity. So try and engage with at least one pleasant activity per day. And if you've got something stressful or worrying, maybe allocate a specific time so that that's not lingering like a black cloud in your head. And use that time to maybe talk about it to yourself, record it, write it down, journaling. Some people find journaling very helpful, and there are lots of courses available as well around journaling. And also being aware of what actually makes you anxious might help increase your reduce your level of stress. So being aware of it and trying to make active changes around that. And I don't know if you've heard of the 4 Ds. So the do, defer, delegate, drop. So what you could do is for the week, for the day, put all your chores down, make 4 boxes, put down what you want to do, what needs done, what you can defer, what you can delegate, which I think as women need to sometimes remind ourselves about, and what actually needs dropped, because does it actually need done? These are all, I think, very, you would think, common sense, but sometimes I think we need to be reminded as well about this because lives get so busy. Next slide, please. So sleep is one of the biggest challenges around menopause, as we talked about, sleep being affected by hot flushes or body aches or going up to the toilet. So what can we do as well, apart from treat those other conditions? Use bed for sleeping, not working. If you don't have a set sleep pattern, then wait till you're tired before you lay down. If you're up in the night for 15 minutes, then get up and go and do something relaxing, like listening to music or reading a book, but not screen time. Avoid napping during the day because napping can affect the sleep cycle. And that could be a whole talk in itself, the sleep cycle. But if you do need to nap, make it short, maybe 15 minutes. If you've got a regular sleep time, keep to that. Limit caffeine, alcohol, which is known, but sometimes decaf can also, I have had women coming in saying decaf products can also affect the mental health. And if you've an herbal tea, just make sure they don't have caffeine in it as well. Meals, don't have meals too late at night. I mean, the general consensus is by 6 o'clock. If you're having it later, maybe don't have a big meal. Don't exercise too late because that's going to just hype you up. And I think the room lighting, temperature, and noise is so important. The temperature, not just for hot flushes, but also I find that sometimes restless legs can be made worse with a rise in temperature. And then other things like making sure your bed's comfortable, diaphragmatic breathing, which we can talk about if there's time at the end of this. So just taking slow, deep breaths, making sure that you're not doing shallow breaths from your chest, but actually breathing right into your abdomen, seeing your abdomen come out, and do that slowly. That can also reduce a hot flush or a night sweat. Don't keep watching your time because that's going to increase your anxiety levels. And also when you wake up, get on with your day as normal. So that's a mindset thing, really, keeping it aside that you're tired and just getting on with your day, because eventually your body will get tired. And also, if you don't get on with your day, I think that can have, well, it does for me, have a negative impact on your mental health because you feel that you've not achieved that day. Next slide, please. So simple things, apart from CBT and HRT and everything else that we've talked about, that you can do day to day, especially if the weather is changing now. There are bottles where you can carry cool water in at the moment. Carry water with you, sip water that could cool you down. Wear layers of clothing so that you could put on and take off when you want, like at meetings and when you're out as well. And I don't know if some of you might have been here when I said, oh, I'm having a hot flush because of waiting for everyone to log on. So trying to humor situations like that and not be too aware of it and not be too worried that it's going to be obvious, I think can also help sometimes because you'll find it just goes right down. And yeah, and try to keep doing what you normally do, really, because that's important to not restrict life. And the deep breaths that I talk about, the diaphragmatic breathing. Next slide, please. So just a quick note about breast cancer and estrogen-dependent breast cancers, or if there's any other reason why women can't take estrogen. Vasomotor symptoms, just to remind you, that's for the hot flushes and night sweats. So if women can't take HRT, CBT may not be helping, plus other lifestyle changes not helping, then there is a new drug that's available, but it's only prescribed by secondary care. So that's the hospital specialist. It's called fezolinetant. So that's something that, I just wanted to put it out there, that's available. History of breast cancer itself is not a total contraindication, but it needs to be balanced, and it needs specialist input, because if your symptoms are severe, then it can be considered. And also, some women do need antidepressants. If you're on tamoxifen, there's, just check that you're on the right antidepressants as well, because SSRIs are selective serotonin reuptake inhibitors like Prozac, citalopram, sertraline. So I'm not going to say go into detail, but always check that it doesn't interact with your tamoxifen. Next slide, please. So is that the end? We've talked about hot flushes, sleep, anxiety, low mood, memory problems. What happens when you get it managed? I don't see it as the end of something. I see it as a different phase of our lives, actually. And I've seen patients have come back and said that they feel better. They've joined Zumba classes. They've discovered hobbies, and it's made such a big impact in their mental health. So I think it's a time of discovery as well, because a huge part of our lives have been around developing our, personal self and developing relationships, careers. And it's probably a time to look inward now and think, have I got something hidden in there? Women can change careers, rediscover hobbies, like I've mentioned, unleash a creative side, start prioritizing themselves for the first time, and therefore finding a new sense of confidence and identity. Yeah, I think supporting women through the menopause is so important, both economically as well as day to day, really, because I think women can reach a stage where they think, oh, I can't cope with this job anymore. And like I said, you've worked so hard to get there. Don't let that, blur your ambitions. Get help. And that's why menopause in the workplace is so important. And the government started a plan for employers of more than 250 employees to have a menopause plan there, and to provide support, empathy, and understanding. What else have I put in there? Yeah, I think I've probably mentioned a lot of that, but also if you're on HRT and you feel, oh gosh, it's not working, go back and see your doctor, because it might be that you're not on the right dose, you're not taking it the right way, or you need instead of a trans gel, you need a patch, or if you're the right one to start with. And if you're bleeding a lot, yes, you can bleed irregularly, just with menopause or perimenopause, and on HRT, your bleeding can get worse. But I think at the end of the day, you know your body well. And if your bleeding is beyond and not normal, you might need to get investigated. And I mentioned bleeding because I think if somebody is bleeding constantly, that can also weigh you down and affect mental health, because you could be going on a holiday and you're bleeding, so your rest time is just taken up with being stressed out by this bleeding that's ongoing. If your mood is still low, there might be other causes. So see your doctor, you might need other treatment. If you're still having hot flushes, lethargy, or your memory is not getting better, then we need to, explore other causes, and you might need blood tests done. And if you're on other alternative treatment, yes, there may not be clinical evidence that they work, but if they work for you, and if they don't interact with any of your other medications, then I think it's fine to continue. Because I think we used to say, oh, it doesn't work, it has no clinical evidence, stop taking it. But, at the end of the day, if it works for you, there's no harm. Because studies, that probably aren't enough studies around these things to start with. And I can't, as a doctor, recommend what these alternative other medications are. But also be aware of what's around, because there are lots of spam advertising around. Yeah, and sometimes you might feel overwhelmed that, oh, I'm needing to fit my relaxing time and my exercise time and my planning, my healthy meals time. But, do it a bit at a time. It doesn't all have to happen. Don't stress out and don't put too much pressure, I think, on yourselves. And I've got a last few slides, and it was just to next slide, and that's just the a new government initiative, as I mentioned, about the employment. There might be there might be more women hubs around to help with mental health as well. And one final slide, and then I'm finished, I think. Yeah, menopause in the workplace. So if you're if you're an employer, an employee, the British Menopause Society have got guidance for employers. And if this is not happening, is it worth speaking to your managers about it, making sure there's reasonable adjustments around at work? And yeah, thank you.
Thank you, Janet. So thank you, Janet, for the really informative session, and for everyone that's joined as well. So I hope you all take something from that, whether that's knowledge, some tips that Janet shared, or an action to take away. Just want to highlight that our Health and Being campaign for May is National Walking Month, which Janet's mentioned a few times in her session about the benefits of walking. So look out for that on our social media pages. So you'll find network members and committee team members sharing their walking pictures. So if you've got anyone to share with us, please send them through. Have a look for our social media pages on the link tree. And walking is such a great way to manage your stress and anxiety throughout the day, as it helps your brain release endorphins, as Janet mentioned earlier, which boosts your mood. And also there's added benefits from spending time in nature if you're doing a walk in nature, and social connection if you're walking with others. And we have got a webinar tomorrow lunchtime about the power of walking, and we'll put the link in the chat for that if you want to join. If you did miss any of the session today or want to revisit in your own time, the recording and the slides will be added to our website, as I mentioned in the chat, in the next sort of week or so. And we'll also send a follow-up email containing some useful links that you might want to take a look at. We will also put the link in the chat for a feedback form, as that really helps us to evaluate, plan and improve future events. And if you do want to join the network, if you're not already a member, the form has got an option to do that as well. So does anyone have any questions for Janet or comments, anything you want to share?
I've also just put my just put my email as well in the chat if anybody wanted to email me about any questions.
Thanks, Janet.
Oh, thank you for all your thank yous.
Got a hand up. Robin, do you want to go?
Hiya, yeah, really useful. Thank you very much. You mentioned about interactions with medication. Do you have any particular take on supplements, whether it's Hookham or if there's anything that's actually really worthwhile taking?
I think, yeah, that's a difficult one to comment on, coming from an NHS background, I think. Yeah, I would say just vitamin D is very important, and calcium. And if you're iron deficient, I guess iron supplements, omega-3 oil capsules might be useful as well, and vitamin C.
Great, thank you.
Provide, yeah, I know there's sort of query about magnesium as well, but I don't know how much evidence there is about that, like magnesium might help restless legs. So I just need to be quite cautious here because I'm a GP and I'm coming from a medical background, and I'm not, a specialist in terms of nutrition and complementary medicine, apart from the CBT that I mentioned. So, but what I've mentioned so far are things that will probably help, like vitamin D is recommended throughout the winter periods for anyone, because we're still, not getting enough sun overall. And that's so important in terms of bone protection as well. So yeah, I mean, you could find a multivitamin to take. There's no harm in taking that, but just make sure it's got the 400 international units of vitamin D in it that's needed. Or you can get your vitamin D in, in the what I put in the slide, the product, the food that I've put as examples, 2 to 3 portions of that. And yeah, vitamin C is important to, I think someone did comment, but I've not seen it, to prevent infections as well, really. So you could try, do you recommend taking anything for joint aches and pains? You could try omega-3 oil capsules to see, but I think you also need to maybe see your doctor first to make sure that, why you've got these aches and pains. Are you lacking any vitamins? and having a discussion with them as well about, what other supplements you can take.
Then I've also got any other questions. I think, Janet, did you answer the one about best vitamin D and calcium supplements?
Mm.
You did, yeah. So I was putting some links in the chat and I didn't realise. Anyone else want
If I've
to...
answered it, did I
Yeah,
answer
did you cover that one?
Gaynor?
Sorry.
I think I did, but I
did.
think Gaynor, do you have any other questions around that, or you're happy?
Just there's a lot of different options out there for vitamin D and calcium. So it was just if you'd got any recommendations for specific brands or formulations. I know vitamin D is quite a difficult one to get absorbed.
Yeah, I think just anything generic is the cheapest one. And if it's got the 400 international units, that's quite good. But if you've got a very low vitamin D, then you might need a higher supplement. And that can be, your GP might need to prescribe that, where you take a high dose for 6 weeks.
Okay, thanks.
There's a comment in the chat, Janet, if you want me to read it out. So someone said, thank you. At the very least, this helps us to understand we're not alone how we're feeling. I wish there was something more to help with managing the symptoms. Support has come a long way since our parents' generation. In a few years, I'm sure research will have caught up and the next generation will benefit. Is there anything you want to comment on that?
No, thank you for sharing that. And I think it is an ongoing thing around menopause as things develop. I think there was a lack of research and funding, unfortunately, I think, in going back to the 90s and things. And there's a lot of historical information about there with menopause. It was always seen to be just ovaries, not seen as affecting other parts of your body. Yeah, it's you can have a big discussion about it, I think, about attitudes about menopause before, now. But I think, I think that's why, there's a lot of campaigns about talking about it. And that's how you can discover yourself as well and discover what other people are going through. So, yeah, so keep the conversation going, as they say.
And someone's put a recommendation for collagen powder. They found that helpful.
Right. That's good. That's helped you. I've got no comments around that, but that's brilliant to know that. Collagen is, it's something else in itself as well, really. When you listen to podcasts about it, people have got different views around it. So, like I said, if it's helping you and if it doesn't interact with medications that you're taking, doesn't give you side effects, that's fine to continue. I'm just going to say, if anybody has, if you've tried this and what I've talked about today, and if you've got any feedback about it, I'll be glad to know, really, if you've benefited, how this has helped you.